Liposuction is basically a procedure in which small incisions are used and long cannulas then are used to help remove the redundant fat underneath the surface of the skin. So it's great for trouble areas, say saddlebags or outer thighs for women, and love handles for men. It can be used to contour abdomens, arms, thighs. Liposuction is not a tool for weight loss. And sometimes I have patients that come in and maybe what they really want is to be 30 pounds lighter. Then instead of trying to do all over body liposuction, we work on addressing how can patients best lose weight. And then once they've gotten down to their more comfortable weight or a stable weight, and if they still have pockets of undesired fat, that makes them now an ideal candidate for liposuction. The goal of liposuction is to remove underlying fat and allow the skin to redrape and to contour underneath the muscle layer or the skeletal frame. And one of the risks for liposuction can be contour irregularities or rippling or dimpling of the skin. And that can be because the skin is uneven and you may have a little bit more fat reduction in one area than the other. Another thing that typically happens after liposuction is patients will form scar tissue or fibrosis in the areas that have been suctioned. That can come off as feeling really hard or firm. And typically over the course of 3 to 6 months, that firmness will soften and settle down. But we want to accelerate that healing. And after liposuction procedures, we'll recommend either a combination of Lipo Massage or massages that's done by a professional that can help kind of even out or soften that scar tissue. We also use external radiofrequency or heat energy here in the office that's applied to the skin after liposuction to help melt some of that fibrosis, help soften the area so that you achieve the more definitive contours more quickly. And so those are really important for helping us achieve the best results after liposuction. After liposuction, we have patients wear compression garments for pretty much 6 weeks and maybe 20 hours a day. They take a break in the morning and the evening, but they're going to use a compression garment to help shape them and mold them and allow that skin to retract after the procedure. We ask patients to avoid exercising for about 2 to 6 weeks, depending on how much liposuction is done. Part of what I'll try to do in my practice is help educate patients on how they can achieve their results and maintain their results, and just to give them some information and maybe referral to a dietitian or somebody that really specializes in kind of helping patients change the way they think about food and understanding their nutritional needs so they can maintain their results.